Let's delve into the topic of cognitive distortions in children. Cognitive distortions are inaccurate patterns of thinking that can affect how a person interprets situations, themselves, or others. A common one is black and white thinking or all or nothing thinking. This is where a kid struggles to find a middle ground. For example, a kid might think, if I don't get an A, then I'm a failure. This is not to get confused with overgeneralization, where to a kid, one event might mean always. For example, if they miss a shot, they might think they're terrible at basketball. Or if they got in trouble once, they think that they're always a bad person. Another common one is called mind reading, where they assume other people's thoughts. So a child might see a group of people whispering, and then they'll think that they're talking bad about them. Or a child might think that a teacher thinks they're dumb despite any evidence. Personalization is another common cognitive distortion. This is where a child will blame themselves. So if their parents are arguing, they're going to be thinking, they're arguing because of me, or I could have done more. If a child is verbalizing cognitive distortions, it's important that we don't immediately correct them. We should first validate their feelings and not their distortion. We should try our best to not argue with them and instead explore their thought process of how they came to that conclusion. We need to be invested in them and show that we care. After talking with them and understanding how they came to that conclusion, we can work with them to develop more realistic thoughts from extreme ones. And try not to get frustrated if they're having a hard time understanding. It takes time to develop these skills, so they need some grace. This is Joe, the PMHNP, and thanks for watching.